I experience the value of personalized medicine every day in my personal care and feel very excited to speak about the promise and potential of personalized medicine across patient populations. We hear examples most frequently in breast cancer, but there really are applications across disease states, and so I'm very excited to participate in this forum today.
I think for personalized medicine we have to include the patient in the discussion. You know what they say, if you're not at the table, you're on the menu. So I think patients need to be put first, and they need to be included in the research, not just in terms of policy, but also in having their cells used. And of course that's highly controversial because of the Henrietta Lacks book. But I think for the patients that I see, they're very keen to be involved in the research and have a better scientific understanding of how diseases progress, particularly in the case of cancer. They want to know whether they're going to progress, whether they're going to relapse, and how do we obviate that. They also want to know how do they pay for cost of maintenance therapy, because most of the burden of care is now falling on the patient with regard to cost. So the co-pays with the insurance premiums the way they are really exorbitant, and that's making it very difficult for people to comply with therapy. And of course side effects make it difficult, so if we could come up with combination strategies that are more effective, together with the predictive tools that predict relapse, then we'd be more effective. So we have the solutions at hand. We have much more advanced sequencing technology that can work on very small numbers of cells. We can adapt that technology to use in individuals by coming up with a microfluidics platform called digital PCR that allows us to look at these targets and then identify for the individual what the essential drivers of relapse are. So we can remove that Damocles sword effect that patients have where they're not sure when they're going to progress. And if we take that sting out of the cancer word, then I think we'll be going a long way to accelerating the promise of personalized medicine.
But I think the future of personalized medicine is using diagnostics to make medical care much more efficient, to diagnose appropriately and then treat appropriately, not over or under treat, and using that key information that comes from diagnostics to truly target and personalize care.
I think, because the future of personalized medicine is pretty bright. It seems to me that the public is buying into it, the medical professionals are buying into it, pharma companies are buying into it, diagnostic companies are buying into it, because it seems like the logical thing to do. If you can get a patient the right treatment at the right time, give them the right dose, treat all the right patients, don't treat the ones who aren't going to respond, that makes the most sense. It makes the most sense scientifically, it makes the most sense from sort of a monetary point of view, from an economic point of view, and so I think it's quite right because everybody's very motivated for this to happen.
Well, I am not a specialist in personalized medicine. My background is in pathology and epidemiology, but in working on some of the coverage decisions that CMS has done over the past few years, I've gained the understanding that evidence of improvement in patient outcomes is going to be one of the key things that CMS will need to justify providing coverage for genetic testing or genomic testing for Medicare beneficiaries. So I think I should say that Medicare has already issued at least one applicable policy at the national level about pharmacogenomic testing for warfarin responsiveness. And that, I think, is one of perhaps what will be many decisions to come. But of course, each case will be judged on its own merits, essentially the evidence that improves patient outcomes.
I think personalized medicine in many cases is practiced today. What we have to focus on are new ways to implement the novel technologies into clinical practice. So solid science, access, logistics, infrastructures, and operations are really important. Reimbursement is a key issue. Medco is working with payers. Payers are our clients to make sure that we are implementing those new technologies into clinical practice. So I think that in terms of bending the curve, we already started to bend it quite a bit, and we are working very aggressively to make it a circle at some point in the future.
In the 21st century, we're in a new era of personalized medicine, where a person's unique molecular signature is going to be used to target therapies, to reduce toxic side effects, to monitor drug response, and to also predict vulnerability to disease. But we need a path forward, and that will require addressing the key regulatory issues as well as reimbursement issues needed to move personalized medicine from promise to practice.